Good afternoon. Welcome to the next in a series of webinars hosted by Health Resources in Action. This is a webinar that will talk about implementation of community health improvement plans. We're calling this Life After the Chip, Measuring Success, Data Reporting, and Accountability. And some of my colleagues will be with us today presenting. Hopefully Rose Swenson will be joining us. Val Paletta, and then a distinguished colleague from Austin Health and Human Services Department, Vina, will be talking about the experiences in Austin, Travis County. Before we begin, though, I just wanted to review the objectives for the day and then set the tone by thinking a little bit about some of the work that Sarah Rosenbaum from George Washington University has done, thinking about community health needs assessment principles. So the objectives of today's webinar are to identify elements of an effective model for collaborative leadership, to describe methods for collecting and sharing data on key indicators to measure progress on community health improvement goals and objectives, to identify challenges and strategies to sustaining partnership engagement. You'll hear a lot about that. And then to share a model for collaborative annual action planning. And so today we'll take you through kind of a theoretical piece in terms of talking about an overview of the CHOD-CHIP work through Val Paletta. And then Vina will be spending some time talking about the experience in Austin Travis County around the core elements of effective CHIP implementation. And will take us through a little bit of what it means to be backbone organization and doing leading and convening work, coalition development, annual action planning, monitoring and reporting, and financial management. And then we'll come back and talk a little bit about accountability and sustainability. So what I guess I'd like to frame today to talk about before I pass it on to Val is to really share with you some things about community health needs assessment from Sarah Rosenbaum from the George Washington University. And those are related to three things. One is when she talks about the tenets of this work is that there is a process for planning to improve community health. And many of you on the phone who are involved in assessment and planning work clearly have identified processes. So we would like to share a little bit about that. The second, that as you go through this process, there's an opportunity to think about how you prioritize and invest in evidence-based interventions and innovative practices. And then finally, to begin thinking about how you evaluate the results of your investment. So as we think about this work, kind of some guiding principles to community health improvement are related to multi-sector collaboration and thinking about how you engage diverse sectors of your population and key stakeholders into this work to support shared ownership of all phases of community health improvement planning, to think about diverse community engagement. And when we think about engagement, what we've learned is people are really effective in thinking about outreach and recruitment. And the big question is, how do you keep people at the table? And our way of thinking about that is we really need to think about how do you effectively engage people authentically in this process so that when you think about recruitment plus engagement, you have higher levels of retention leading to impact. We also, from this framework, want to think about a broad definition of community related to targeted focus areas and population-wide impact, maximum transparency among all stakeholders to improve engagement and accountability, the use of evidence-based interventions and innovative practice, evaluation to inform continuous improvement goals, and then the use of the highest quality qualitative and quantitative data. So as we think about those frames in terms of this work, what I'd like to do is then pass it on to Val Paletta, who will talk a little bit and provide some background information on CHOD-CHIP work.
Good afternoon, everyone. Thank you so much for joining us today. I also want to mention that this session is being recorded, and all participants will receive a recording or have access to a recording of the webinar as well as a PowerPoint presentation. If you do have any questions throughout the presentation, do feel free to enter those in the question box. It should be to the right of your screen. And we hope to have some audience interaction throughout, so please participate. So I'll be providing a brief overview of the community health assessment and community health improvement process that we conducted in Austin, Travis County to set the stage for Vina's presentation on the core elements of effective implementation. But before we get into that, we understand that we have a really wide range of participants representing hospitals, local and state health departments, and other stakeholders. So we're really interested in hearing from the audience about your experience with assessment, planning, and implementation. So we're hoping that everyone can take the opportunity to participate in some of these audience polls, starting with, have you completed a community health assessment or community health needs assessment? And so if you can just reply to that to start, either yes or no. We'll give everyone a moment to respond. Okay, terrific. So it looks like nearly 70% of respondents said yes, they have completed a community health assessment or community health needs assessment, which is terrific, and about a third of participants have not. And then how about, has anyone on the webinar completed a community health improvement plan or implementation strategy? So if you can take a moment to respond to that poll. Terrific. So we can see that more people on the webinar have completed a community health assessment than a health improvement plan. So we're glad that you're joining us on this webinar, since that's what we'll be focusing on today. The last question is that if you have completed a community health improvement plan, where are you in the implementation phase? So we have haven't started yet, just beginning to think about it, beginning implementation, or well underway. Terrific. So we have about 30% of those who have done a CHIP haven't started yet. And we also have nearly 40% are beginning implementation, with fewer who are well underway. So we're really looking forward to your questions throughout the presentation as we discuss the process that happened in Austin, Travis County. Thank you, everyone, for responding to those questions, and we'll have some more as we continue. All right, so for those that may be less familiar with the community health assessment, community health improvement process, we just wanted to spend some brief time talking about that. So according to the National Association of County and City Health Officials, a community health assessment is a process that engages with community members and local public health system partners to systematically collect and analyze health-related data from a variety of sources. So the assessment findings provide a comprehensive portrait of the community on health-related issues. Importantly, it's a data-driven process, and it's really helpful for guiding future planning efforts across a common geographic area by identifying areas for needed services, as well as assets and resources that can be leveraged moving forward. And importantly, which we'll be talking about, it can provide a benchmark on key indicators for future efforts as well. A community health improvement plan is a broad action-oriented plan to improve the health of the community. It usually includes anywhere from 3 to 5 priority areas or goals. And the time span is usually around 3 to 5 years. So what can you envision achieving in the next 3 to 5 years? And it's helpful because it also can identify opportunities for partnership and identifying assets that you can leverage to address the priority areas. Why is a CHIP important? I think it's important because it addresses the findings of a community health assessment. It's really valuable for bringing together multi-sectoral partners to coordinate strategies across the community and reduce duplication of efforts. And it's also really helpful for leveraging existing resources so that you're not reinventing the wheel. Here is a brief timeline of the process that was conducted in Austin, Travis County. You can see that from January to June 2012, we conducted the community health assessment to identify the health-related needs and strengths of Austin, Travis County over a period of about 6 months. And then in the subsequent 6 months, from July to December 2012, a community health improvement plan was drafted to determine the major health priorities, overarching goals, and specific objectives and strategies that could be implemented across the community strategically. And Vina will be talking a little bit about this later on in her presentation. And then last year, an action plan was developed to implement the CHIP in Austin, Travis County, and where they're currently in the process of implementation. So before I turn it over to Vina, I just wanted to highlight what the priority health issue areas were that were identified in the community health assessment and then prioritized for the health improvement plan. So you can see that there are 4 core areas that emerged from the CHA, and these focus areas were identified through a ranking process that engaged the core coordinating committee. So ultimately, the 4 community health improvement long-term goals that were determined for Austin, Travis County were to reduce the burden of chronic disease caused by obesity, improve access to affordable, quality, nutritious food, increase accessibility to community resources via safe, active transportation, and lastly, expanding access to patient-centered medical homes for all persons. And with that, I'm going to turn it over to Vina, but we are going to pause here just to see if there are any questions from the audience. Okay, Vina, take it away.
Great, thank you, Valerie. Good afternoon, everyone. My name is Vina Vishwanathan, and I oversee Community Health Improvement Planning and Public Health Accreditation at Austin Travis County Health and Human Services. I first want to thank all the participants for joining, and I truly appreciate where you all are in the chat and CHIP. And I'm looking forward to hearing your questions, and also especially from those who are well underway. I see there's about 14% that are well underway with their CHIP. You may have strategies that work really well for you, so would love to hear them. Also, I want to thank Health Resources and Action for having me with them as a guest. Okay, so core elements of effective implementation for the CHIP. So leading and convening, what you really want to have, what you want to focus on is having a strong core. So steering and core coordinating committees, and they really support the backbone of your collaborative organization. Coalition development, so collaboration development or to strengthen existing collaboration. Annual action planning, planning, measuring progress, and reporting to community. And that's also for monitoring and reporting progress on key indicators and metrics. So how you monitor and how you report really determines how well you're engaging the community. So are you being open and transparent with your information? Where are you posting this information? We'll talk about posting to websites and also the limitations around that. Are you having community forums, and how else are you engaging others? And then lastly, financial management. So how are we managing funds? How are we financing the CHIP? And are we looking for other grants or other types of foundations that could help fund the CHIP? All right. So our next slide is leading and convening, the backbone. And so our backbone focuses on infrastructure and oversight. So our existing body for the CHIP has an advisory committee, or the steering committee, and they really provided the oversight for the community health assessment and the community health improvement plan, including the identification of priorities. We then have a core coordinating committee, and they're kind of the worker bees of the entire process, and they manage the entire process as well. And both the steering and the core, they come from a core set of agencies. We worked with the hospitals, or nonprofit hospital partners, our university system, or large university system, our healthcare district, our county health and services, our transportation, and our mental health authority, including many, many other organizations. So all of those people, the executives, form the advisory committee, and their directors of planning, managers, they focused in on the core committee. We also had CHIP work groups and summit leaders, and these represented diverse sectors of the community, and they formed around each health priority. And how we recruited these people is actually trifold. We went to the community when we presented our community health assessment, and we marketed and encouraged community members to participate. And when I say community members, I'm talking about residents, partners, stakeholders, and elected officials. So when we were recruited for that, we had a lot of course, and I'm sure all of you can relate, we had a lot of partners respond. So we really had to target more community members. And the way we did that was we went to community meetings. We had steering committee members and core coordinating committee members go to certain events, and we reached out to people for them to join. So as you're looking at this, wanting to know, kind of think about your own structure and how it helps or how it will help organize your process and ensure stakeholder and community engagement. Something else to think about is our process was iterative and flexible. So when we had our community health assessments, for example, we had many ad hoc committees. One of those committees was a data and research committee. And during the community health assessment, you're working with so many indicators and research. And so we had to have a very structured committee ongoing, very intense committee working on that. As we transitioned to the CHIP work groups and summit leaders actually took over that responsibility. But as we're in implementation of the CHIP, we're realizing we may need that group back, not only for data pieces to monitor data and to gather performance measures, but also we're exploring GIS functions. So the point that I'm trying to convey is that it's ongoing, and you may need to add committees well into the process, and you want to keep in contact with the committees that you had earlier in the process as you implement your community health improvement plan. Okay, so something that's really interesting is a little bit more background is that our community was selected by NACHO, the National Association for County and City Health Officials, to conduct a robust health assessment and improvement plan. And we were given a small stipend, a very small stipend, but a lot of technical assistance and training that was superb. And so we were very lucky in that respect, and the reason why we were selected is because we said that we were working with a strong team, and that was true, and we had committed members on the table. We actually started, Valerie presented that we started in January 2012, and that is correct. That's when we delved into the health assessment. But we actually started forming as a community and developing our steering and coordinating committees and other committees in August 2011. And what was very challenging for us is that our department found itself in a position where we were facilitating and leading a process in which we wanted to be a team member. So we knew there had to be someone organizing the meetings and coordinating, being a point of contact, but we also wanted to be able to participate and be seen as objective, and be able to express our own opinions at the same time as being objective is kind of difficult. So while we were in the process between between August 2011 and January 2012, we were building rapport, we were organizing for success, and we were also speaking with health resources in action, and we were trying to establish a contract. And you know, I work for a city, so it takes time in establishing a contract. So we used that time to really beef up and build up our team. And once we got HRIA on board, it was actually pretty amazing because they had so much expertise in community health improvement planning, and they were able to come on and facilitate our meetings and our process, and they were neutral. So it was really rewarding, and also we could blame HRI for things that were happening. I'm just kidding. But certain things like that, where we were able to be a participant, it really went a long way. We also were able to have a dedicated staff. We have, during the time of the community health assessment and the development of the CHIP, I was a project manager. And after the health assessment and hire a planner, and that was because we documented the amount of time and the amount of resources required to do a CHA and a CHIP. And our staff, our managers, not only at the health department, but the executives at our steering committee realized the need to hire someone on, and they fully supported that. So the main point is documentation goes a long way. And you want to ensure that, from speaking with many sites about community health assessments and improvement plans, something that stood out is that there's a lot of burnout. So you want to make sure that you cycle staff and you have a strong core team. Convening and coordinating meetings. We did a lot of community forums, and then also steering committee meetings, core meetings. We had a variety of work groups and summits. But excuse me, something that stands out pretty well is we had an event called Break for Breakfast, where we hosted the Health and Human Services Department hosted many partners and stakeholders to just come and meet for breakfast. And we didn't tie it specifically to CHIP. We just kept it open, and we tied it to actually anything that they wanted to discuss that was relevant, because there are so many priorities that were occurring, that important things that weren't tied to that weren't included in the CHIP. And we wanted to make sure that we were covering things that were important to the community and that we were also aligning our efforts. So that's a strategy that had worked really well, and we're actually going to continue that. And what was reported to us that what helped our partners really a great deal was that they were able to connect and network with partners and non-traditional partners that they hadn't already been working with. Particularly our hospital partners were able to meet with social service organizations and faith-based institutions that they had not met before. So that went a long way. We also, as far as decision-making, because the community health assessment was, the priorities was determined by the community members, that actually went a long way in supporting the actual priorities for the CHIP. So whenever we have engagement with elected officials and we're trying to establish firm budget plans, we go back and say that was what drove this improvement plan, was the community's voice and our data. So that actually goes a very long way. Our ultimate decision makers are not only our community members, but our steering committee members and our core. We all work very closely. We also pull in our CHIP work group members and our summit leaders. And then moving on to reporting and transparency, we kind of did the usual things in the beginning. We did email, we did meetings, and then we moved forward and we started doing more forums. So with the community health assessment, we were able to do focus groups, key informant interviews, and then a few community forums. But with the community health improvement plan, we realized that we weren't reaching all the people that we wanted to reach. Really hard to reach populations and disparate populations. So what we did, and this was actually my boss's, Shannon Jones's specialty and something that he was very much committed to, he went out into the community and found partners that were really interested and engaged within specific groups that we couldn't reach. And he asked them to speak to the community about the improvement plan and how they thought they could be involved. And so that occurred, those types of meetings occurred at apartment complexes, at churches, at a variety of areas where it was really hard for us to go, being with different organizations, but it was better with other community leaders doing the process. So that's something really that worked out very well, and we're continuing to do that with other groups in our area. Something else with reporting and transparency that is quite interesting is that we got lots of free media and press because one of our goals, access to healthy foods, or one of our priority areas, access to healthy foods, focused on a healthy food zone or healthy food ordinance. And we shared all of this information. We put it on our website. We had press releases and so forth and forums. But what really caught some lobbyists' eyes was that at our city council, someone was very interested in healthy food zone ordinances. And then all of a sudden, many fast food restaurant owners and lobbyists came to our city council and were very concerned about what we were doing. So it was an opportunity for us to engage them, and now they're actually at our Access to Healthy Foods meetings, and they support some of our strategies on incentivizing healthy foods. So involving other stakeholders that you may not normally do and getting their attention can really, really help out in the long run.
Great. Thank you, Vina. Before we move on to coalition development, we wanted to do an audience poll. So Vina, I think, spoke to the important or critical infrastructure that they were able to put in place with clear roles and responsibilities of their committee members, which was really important for an effective implementation process. So before we talk about coalition development, we wanted to ask the audience, what is your primary concern or challenge regarding implementation? Or perhaps if you're not quite there yet, what are some concerns or challenges that you are forecasting before you enter the implementation process? And we have some close-ended response options here, but if you have any others to add, do feel free to do so in the question text box. Okay, thank you. So it sounds like the majority of you, nearly 2/3, are really seeing commitment and accountability of partners as a key concern or challenge, understandably. So that's actually what we're talking about next. So that's a great segue.
Okay, so coalition development. What's critical right now, and one big takeaway that would be wonderful for you to get out of the presentation is framing. So how we frame messages and information to stakeholders is critical. I'll give you an example. Yesterday I was meeting with our transportation leads, and we were trying to figure out action items, action steps, and who would be in charge of each one. And they said, Vina, health is really important, but for transportation, we have to think about our needs and how we're going to explain this to our bosses about how important it is to us. And so we see the community health improvement plan and the stakeholders involved as another argument for us. So we get support and we get a lot of advocacy and backup when we're at large planning meetings or when we're at city council or commissioner's court. So we get a voice at the table for active transportation, for example. And so that's huge. So your local public health system can actually be an advocate for various sectors of your community. And that's one of the ways to recruit and retain partners, is to make sure that you frame messages that meet their objectives. So each agency, they're looking at their own strategic plan and business plan, and they're trying to figure out how their involvement in the CHIP will help them. So you have to go back and work with them. One of the strategies that we employed is before we implemented the CHIP, we went back to our leaders, some of our key informant interviews, and we asked them what's working well and how do you see the CHIP impacting you. And that type of information, the information that you receive from those conversations, can really help how you form and redevelop your CHIP. As far as retaining, another way to retain partners is to make sure that you're aligning existing resources. So whatever else is going on in your community, the programs that you're working on, certain organizations are doing major initiatives like DSRIP and 1115 waiver. So you can actually say, okay, we're going to share resources, we're going to share staff, we're going to share financial resources, and be able to develop our coalition more by working with each other. Something else that is very effective is recognition. So how to retain those partners. So recognition during press releases, maybe a message from city council or county commissioners, something like that, where agencies also get free press on the great work that they're doing. As far as communication strategy, that is actually something that we're working on improving with the implementation of the CHIP. So We're looking at having newsletters, and we're also looking at having a community or data portal, which I'll talk about more in a little while. But really what I wanted to convey is that we didn't have a shared website when we began the chat chip, which made it very difficult to show progress of the work that we were doing. So for those of you who are just starting out, or with your chip or even with your CHA, just start thinking about different ways that you can share information. I know some sites had a website already where it was a shared collaborative. Some sites went to Google and set up shop there, Google Groups. And there's many different ways you can approach this, but having a shared site helps tremendously. And so why collaboration? When health departments or hospitals are leading a community health assessment or improvement planning process, it's really important to look at the collective impact. So, and that's something that we're actually moving towards. Right now, we're more of a multi-stakeholder agency where we have many organizations working on our community health improvement plan, and they're looking at issues and we're collaborating quite well, but collective impact actually goes beyond collaboration. It's engagement at leadership levels and decision makers. It's continuous communication. With collective impact, a lot of like CEOs and executives, they meet twice a month, and they talk about return on investment. And most of these meetings and these engagements are facilitated by external facilitators. So if you all are in the process, I would love to hear more about that if you all think that you have a strong collective impact group. But collaboration, it really improves how we look at our implementation of initiatives, our evaluation, and how we continuously improve our process, content, and then our impact for healthy communities. Moving on to the sector and stakeholder wheel, we're looking at engagement at various levels and activities. And this is something we actually use in the development of our health assessment and improvement plan for various priority areas and also for engaging many different partners. And for those of you who are health departments, this is something the Public Health Accreditation Board actually requires engagement with traditional and non-traditional partners, community members, disparate areas, and elected officials. So looking at these sector wheels just takes us to a different level and lets us see information in a new lens. And when you're looking at this for your community, especially those of you who are just starting the process, think of who is at your table or who you would like to be at the table and who is missing and who should be included. During our health assessment, we actually did not have our mental health authority at the table or transportation. They were at the table, but not at our steering committee or core levels. But once we found that within the assessment, mental health and transportation was really high on our community's list, and that became a CHIP priority, we actually engaged those leaders within our CHIP. So again, this is an iterative process, and it can change, and it's important to be flexible.
Thank you.
I think we have another poll.
Yes, thank you, Vina. So we're interested in hearing from the audience, and this is not a poll question, it's just sort of open-ended, is what strategies have you used to engage partners in your health improvement planning or implementation? And so if you have thoughts to share, please use the questions box to share your responses, and I'll read a few off. So we have one holding a summit, one-on-one meetings, creating a community health improvement compact or maybe that's contract to create partners in the process, joint meeting solicitations, doing focus groups with diverse participants so those who maybe experience health disparities. Having communication directly from the health commissioner to community partners, and ensuring that all partners have access to community meetings to talk about their services. We have creating advisory committees for grant-funded initiatives, having formal affiliation agreements. Terrific. So those are all wonderful strategies. Thank you for sharing. And I think now we're going to have Vina talk a little bit about annual action, their approach to annual action planning.
Thanks, Valerie. So for our first year, our CHIP is actually a 3-year plan. So each year we're planning on holding a summit for the action items or action steps that the summit leaders and the CHIP work group will focus on. And so for our first year, our planning summit focused on, we had already done the goal, objectives, evidence-based strategies, and then we were focused on action steps, and we actually used the Wisconsin CHIPS infrastructure project template, which focused on lead person, organization, resources needed, the outcome, and then also a timeline. And what that provided provided to us was organization and structure, and it really helped sustain accountability throughout the process. It was also a very handy reference tool for where we needed support and what gaps we had, and it also helped show alignment with various organizations. We also, what we learned from planning, because we just started planning the second year summit for the annual action planning, is that we're needing pre-meetings and work sessions prior to actually having a summit. Because what we found the first year is that we had a summit and we asked for decision makers and leaders to be at that summit. And while we did have many, a lot of people had to go back to their bosses and make sure that their bosses supported the work that they were doing and the resources that they were committing. So we actually realized that we needed to have more built-in work sessions. Something else that we learned from our first year is that it's important to be flexible with the timeline. There'll be different things, different priorities that are happening in your community, and you may have to shift resources. We also learned that one of our focus areas or priority areas is access to primary care and mental behavioral health care. And from one of our recent core meetings, we found out that DSRIP, which is something that we're using heavily within that priority area, a lot of the timelines are different from our community health improvement plan. So we needed to update some information, and the reporting actually didn't fit into this CHIP structure. So we had to find different ways and different strategies to make sure we convey that information in a meaningful way. Monitoring and reporting progress on key indicators and metrics. So right now we're actually in the early stages. We've finished the first 2 quarters of the CHIP, and most of the information is process updates. So we haven't really moved the needle yet or anything like that, but we're gaining more information as we go along. And what we found very useful to receive these reports and involving our core and steering committee is that we'd like for them to review this information as a team and report and do some quality improvement on it, because sometimes what we're finding out is that people may not be reporting on all the information that is being asked. So, for example, if they're seeing information that matches another existing project, they'll be reporting on that, but it may not be exactly what we're looking for. So we have to go back and work with them on content. And it's a good way to engage your steering and core committee members as well. Something about more on sharing indicators. We had been looking at data portals, and again, that's something I mentioned before, where we didn't have that in the beginning of the CHIP, and that's something that's really, really important to consider as you go about doing your CHIP. It provides reporting and transparency, You could have progress updates. You could have scorecards. It's incredible marketing potential. Community members could use this. Stakeholders could use it, and partners. It also helps prioritize resources for decision makers. So where there are gaps in your progress, where you may need some financial resources or even knowledge resources or staff power, other organizations or even funders may be interested in seeing this type of information and using it to develop RFAs. And then also, of course, it's an effective tool for stakeholders, elected officials, and even students. Our health department gets a lot of calls from students about data needs, and we set up different meetings. And having such a tool and being open with information would be very, very helpful, and that's something we're looking into. It's also something that our elected officials may be interested in. And we've had different meetings talking about having scorecards and showing progress on major initiatives. And that's something that if you could kind of pitch it at a local level, at an area where you have council members interested in how their community is doing, that's something that could really help you out with resources for that specific area. Okay, dissemination. What I wanted to focus on for this area is, as I mentioned before, we're in the first year of our CHIP, and what we're finding now is we're getting a lot of process information, and that is okay. We're slowly building towards the content, and that's something just to expect and be prepared for in your first year, especially when you're talking to your bosses and your leaders, and they're wanting to see obesity drop by 5% or something like that. You just have to be realistic about what the CHIP is, the CHIP timeline, and the information that you're collecting for that first year. Also, for reports and updates, we post that on our Health and Human Services Department website, and our partners will also have the ability to post it on their sites too. We're looking again at data portals. We do have a designated CHIP email and phone line where we do share information on progress. And then we're doing more. We actually have 2 forums each year talking about the CHIP. We have those targeted forums that I mentioned earlier, and we're doing an annual progress forum. And what we're trying to do is we have our larger county, and then we have the city of Austin. So we're trying to go to various areas of the county and present information so we don't create any barriers between demographics and geography. And then we're also sharing the information with elected officials. As I mentioned before, the lobbyists and the fast food restaurant owners were very interested in access to healthy foods. And because of that, our elected officials became more and more interested with the CHIP. So sharing reports and updates has actually become even more mandatory and more important for our work environment to make sure we're on track. And next, financial management. So we actually have an interlocal agreement with our county health and human services. So the health department in which I work for is the city of Austin. And the interlocal agreement we have with the county actually means that we provide public health services to the entire county. So we have about 1.1 million people in Travis County, and the city of Austin represents about 2/3 of the population. So we have a $3 million interlocal agreement for public health. And what we were able to do is establish a certain amount of money for the community health assessment and improvement plan. So that helps fund certain initiatives that we're doing with the improvement plan, definitely planning and contracts. So that's something that occurred a couple years ago, and it's built in, and it's helped us finance our entire parts of our community health assessment and improvement plan. Also, with financial management, leaders in the community are taking on tasks because it aligns with their existing projects and programs. Some examples of that is the Affordable Care Act 1115 waiver, and also known as district projects. so a large part of our access to care and also our chronic disease and access to healthy foods and even parts of our transportation priority areas are connected with some of the 1115 waiver money. And so we're able to pool some funds in even though that we didn't have any new grants or new funding. We also have a city plan called Imagine Austin, and we're able to align efforts and some funding within that. And then last but not least, Community Transformation Grant. That is actually critical to our chronic disease, our obesity priority area, and our access to healthy foods priority area. Now, we're losing that grant. I'm sure many of you are aware and actually have that funding. But we're in the third year, and they just announced that we wouldn't have those funds anymore. So that's actually a nice segue into shift in resources and identifying gaps. Because of our growing planning needs and resources and us struggling for grants and monies and the elected officials being involved as they are now, we're able to speak with them more on a level that they understand about what we can do as a city and a county in meeting these needs. And we have dedicated core and steering committee members as well. So we're hoping that when we go to budget and when we go to our council, we'll also have support from our community members and our strong network of partners about gaps and how we can meet those gaps. Something else that's very interesting is the hospitals, especially with the Affordable Care Act, they have an increased public health focuses in not only hospitals but also health organizations. So what we're seeing is more and more agencies hiring public health educators, hiring epidemiologists. So that's more resources for us as well. And lastly, I wanted to talk about different ways you can reach out to the community, the philanthropic and foundations, everything, and kind of engage them in your work. A colleague of mine and I went out to a funders group, and we were talking about the health assessment and the improvement plan and just really sharing information and trying to get ideas from them about how they would like to see this type of information. And unanimously, they all supported that a data portal or a community portal be developed so they could see the gaps and they could help with resources. So I would love to know if any communities out there right now have that type of situation. And that's actually all I have for me.
And so what I'd like to do, Vina, thank you so much for taking us through a case study of all the good work that's happening in the city of Austin and Travis County through the Health and Human Service Department. The final piece I guess I wanted to talk to before we go into questions is the notion of really accountability and sustainability. And if we go to the next slide, kind of our working definition of sustainability is a process of maintaining an initiative by weaving a practice, a way of thinking into the fabric of community. And as we think about all the wonderful things that Vina put out in front of us, as well as thinking about the principles I identified up front that Sarah Rosenbaum developed through the Community Health Needs Assessment, which we're happy to share with all of you on the phone, is that when we think about this work, and if we want to really think about sustainable efforts, there are core elements. And so building on what Vina talked about, just to reiterate those, if we think about leading and convening and the roles you can play as leaders and conveners and effective communication that leads to multi-sector collaboration, that is, and thinking about that level of collaboration through all these stages from assessment to planning to implementation, there's going to be a greater likelihood of success in your community about addressing population health issues. When we think about the second element around coalition development, it's really important to think about a process of recruiting and engaging diverse multi-sector populations in this work and developing an organizational structure with clear roles and responsibilities, levels of communication, and accountability. What we're finding in communities is where this happens, there's a greater likelihood that the group is able to move forward with as minimal conflict. Where this doesn't happen, sometimes this is a hindrance to moving forward. A third area around this notion of sustainability is annual action planning that includes, based on data and has goals, objectives, and measurable objectives and strategies that is coupled with a monitoring, reporting system that looks at indicators and metrics, and that you're communicating this regularly to the audiences that you're working with. Another area of sustainability is maintaining diverse financial resources. And I would actually even say it may not be just financial, but it would be resources in the sense that it could be dollars, but it could be in-kind support, it could be volunteer support. So when you think about a sustainability plan, to think about those various aspects of resources and diverse resources. And then it's also important to build on local assets and efforts. The beauty of this work is that when we think about some of these potential priority areas, is we have an opportunity to look at what's currently happening in the community as it relates to task forces or coalitions or partnerships that are currently doing this work, and bringing them into the discussion from the very beginning, so that when it comes time to implementation, you're not creating parallel processes, but you're building on the work of some of the good work of some of these coalitions and task forces. And then finally, something that we all have learned is to really identify community champions through this process. And those champions may not be the core people working on this work with you, but these are community champions that have access to resources and the political will to support your work. So this whole idea of transparency and effective communication is really important to figure out how to engage them, maybe not necessarily in regularly scheduled meetings, but to communicate with them about the good efforts of what's happening. So with that note, what I wanted to do is close out this piece and thank Val and Vina and Rose for the good work that they've done, and for people behind the scenes, for Ben and Stephanie and Judy, for all the good work that you've helped us to pull this together. We will be sending you a follow-up email with this recorded presentation and an evaluation form that we would ask that you would complete. It would be very helpful for us. And then we could also send you the CHNA principles that may help you think about this work. So before we close out, though, again, thank you to my colleagues, and thank you to all of you for participating. Why don't we open it up to see if there are any questions that we might be able to answer for you, or if you have any comments.
And if you do have any questions or comments, if you could use the text box for questions.
And yes, Kitty, we will use include the contributions of the participants in terms of the survey results today. We actually found those to be really interesting, so we're more than happy to share those with you. And then we see another comment from a colleague in terms of, do you have a data repository for your priority items? Vina, do you want to talk about, do you have a data repository?
Sure, yes. So for our community health assessment, when we gathered our indicators, we actually made that available to our partners and community members that were interested in having that information. And then as we collect more information, and we're planning on, gathering our data and research committee back again, reforming it, and having them monitor that information. But we do have a data repository. We need to clean it up a little bit more, but we would like that information to be on a portal eventually.
And Vina, I want to support that idea that having that information on a portal will not only be helpful for stakeholders, but in terms of communicating your message and your progress to others. So this is a big effort that many people in the country are looking at. For those on the phone, you may know of these national resources, but we would also encourage you to think about either the county health rankings and or the roadmaps to health portals through the University of Wisconsin. We'd also encourage you to think about the CDC, the Centers for Disease Control and Prevention. They have a great website called chna.org or www.chna.org, where there is a lot of good information. And more things will be coming from them in the near future. Are there other comments or questions from participants? Okay, without any more comments at this point in time, again, we thank you for your time. We thank you for your energy in terms of the work that you've been doing in your community. We will send out this information to you, this recorded information, as well as some of the things we've identified today in terms of resources. And again, we ask you to complete the evaluation form. And good luck with your CHA chip and chip implementation efforts. Thank you very much, and have a good afternoon.